have say, hey, I might have a Demodex issue going on? I mean, it's new to hear for a lot of folks.
Yes, one of the most common things, particularly upon awakening, I ask patients when, especially upon diagnosis, when I see them and I look under the microscope, so easy to diagnose, and I'm noticing these special kind of, they're called collarettes, but it's a special crusting that occurs along the lash base when patients look down. So very easy to diagnose. But when I see that, I know that patients may have that mattering, crusting in the morning. They may be itching of the eyelids. A lot of patients think that that is allergic conjunctivitis or allergies, pollen, allergies to contacts, and it's not that. They may be red upon awakening. So they're saying, oh man, my eyes are tired, red, itchy. And that constellation of symptoms sounds very much like it could be something else. But there's a core group of symptoms that are very much common more to Demodex blepharitis.
And I heard another physician mention when folks are kind of itching at their eyes when they have a Demodex issue, they might itch differently. I don't know if you've noticed or could talk about that.
You're absolutely right. So, with itching, which is a very common symptom, when you're itching into the corner of the eyeball, that might be more towards an allergy. Now, Demodex blepharitis patients still can do that. But when you notice you're scratching more towards your eyelash line, that may indicate that it's because the crusting all across those 100 to 150 lashes may have more of that Demodex blepharitis, which of course that Xdemvy gets right at those mites and takes care of that Demodex blepharitis.
And can the Demodex also affect glands?
Yes. Oh, I love that you mentioned that. So just like Demodex mites love the little oil glands within the lashes, they just have a tendency to populate our glands. So it naturally does populate the glands within our skin, and that's how it actually gets into the glands of our lashes. Similarly, it can get into the oil glands and our eyelashes behind them. There are other oil glands that exist there. Not to belabor too much, but some of those glands are called meibomian glands, which contribute to the tears. And that's why the connection to where inflammation can worsen those glands can lead to Demodex blepharitis worsening other parts of the eye, leading to worse dry eye.
Got it. And it's my understanding ocular rosacea can also make that Demodex worse, but not. You might not hear all doctors pointing that out.
Oh my goodness, Julie, that's such a great point. So, similar to Demodex blepharitis being related to these invisible ecoparasite mites, ocular rosacea has a very strong connection to the same type of mites. So, similarly, being underdiagnosed, but something that we as doctors do diagnose, there is that strong connection. So ocular rosacea has that connection, and ocular rosacea is something that there is not a true medication for that is RX approved, but we can diagnose it. And looking under the microscope, that can lead to a lot more of that redness, and certainly it can affect the glands accordingly.
And eyelashes, can they be affected too? I've heard sometimes you have bald spots on your eyelash line from these Demodex.
Yes, Demodex blepharitis can have all sorts of implications that are negative to the eyes, including bald spots. You know how we notice that a lot of our lashes get thin? So for that, we'll do false lashes because of the thinning. That is actually a sign of Demodex infestation or overpopulation. It can also be where the lashes go wayward or they're really stumpy. That is a very classic sign of Demodex infestation. Treating with Xdemvy, which is only twice daily for 6 weeks, patients do start absolutely noticing that their lashes grow in, and the lashes grow in fully.
Got it. Yeah, and can we get back to the good thing about this condition is that it's treatable.
Yes.
So if there's a problem with Demodex, and first off, is there a kind of a barometer for Demodex? Like we all have it, but it gets to a point where it needs to be treated. So is there kind of like a spectrum?
Great question, Julie. So, Demodex blepharitis, any level of crusting within the eyelashes and crusting from Demodex blepharitis is the actual sign of Demodex blepharitis. None of that is supposed to be quote unquote normal. So, when doctors diagnose Demodex blepharitis, when I see a patient walk in and I examine them by looking down, and if I see any crusting at all, whether it's one or two crusts or 150 collarettes or the crusts, it is enough for me to want to diagnose Demodex blepharitis and treat it because it doesn't go away on its own. And I know that if I don't treat it, it's going to worsen and have its downward side effects if untreated. And that can lead to the bald spots, like you mentioned, and other comorbid or other conditions that can affect the eyes down the line. And I want my patients to have the best eyes possible because it can lead to fluctuating vision, and that's going to lead to outcomes that are not positive. So I want to treat patients when I see it.
Got it. And so let's return to treatment options. So can you give us an example of a protocol that you like for your patient?
Yes, for myself, I will say that until about a year and a half, 2 years ago, there were only homeopathic options for our patients available. Now, those homeopathic therapies, which are still opportunities that are available, they're chronic therapies that have to be done all the time, and they don't get to the root cause effectively, which require constant repeat therapies like doing a wipe all the time or doing heat all the time, and they don't effectively get to the mite. The beauty of utilizing Lodoline or 0.25% or Xdemvy is that it kills the source, so it gets to these invisible mites by taking care of actual Demodex blepharitis, those mites, and thus by taking care of it, it is effectively treating the root cause, and then it gets rid of the collarettes within the 6 weeks by utilizing it twice daily.
And then typically once that treatment plan, the 6 weeks goes by, do these patients tend to have recurrences or have to keep an eye on it, or what moving forward would be their maintenance program?
So maintenance therapy, I generally stop all maintenance therapy unless they're using tears for other reasons, of course. But from a Demodex blepharitis perspective, I don't have them use any therapy. They do come back for follow-up. And generally, what we've seen in the long-term outcome studies is that about 6 months to 9 months, about 20 to 40% start to have a low level of recurrence. So this ends up being probably that the mites, because these still live in our skin, do have a tendency to then find their way back into the lids and then start to overpopulate. And then patients, because they're, once they do start to, hey, you know what, whatever brought them in for what was causing us to treat the Demodex blepharitis, they do become aware and they can, between that physician-patient relationship, then they'll guide the doctor, or the doctor may notice it on exam again.
Got it. And then just a few more questions here. As far as triggers for Demodex blepharitis, like the overgrowth for that to occur, is there any maybe common themes that you're noticing? Like we mentioned ocular rosacea, but are there any other conditions or triggers that would cause an infestation?
Sure. So in the literature, what is known, certain metabolic states like diabetes or immunocompromised states, so something like lupus, those are known to be correlated. But things like lid hygiene or just even systemic hygiene, none of that is actually correlated to Demodex blepharitis. So washing your face, and I always, talk to my patients about this, washing your face 20 times a day would never help this, so a lot of the activity from the overactivity of Demodex blepharitis, the mite party's happening overnight while you're sleeping. So there's nothing that you could do to make this go away. So certainly it is related to, there's some comorbid states, but it's not anything related to hygiene.
Got it. Good to know. And then, so you mentioned the hygiene stuff, but in general, do you have any, and you don't have to answer, but recommendations in regards to mascaras or different eyeshadows or eyeliner? I know one common complaint for dry eye, especially women, is backing off those cosmetics. But do you have any recommendations as far as what might not hurt the eye?
That is an excellent question. Once you are diagnosed with Demodex blepharitis, it doesn't hurt to go ahead and throw away the actual makeup product that you are using and starting afresh, because there could be that possibility that it is just from there are studies that demonstrate bacteria that can live in higher ratio when the crusts of the Demodex blepharitis are within the lashes. So that could get into the actual makeup products. So to prevent that kind of cycle, it's just good, probably good advice to just start afresh again.
Got it. And anything else you'd like to add as far as just tips, recommendations, what else to know?
I think, we all think that some of our symptoms, maybe just artificial tears will make it go away. Well, if we're using artificial tears or re-wetting drops more than once a day, that's actually already a lot. If we're waking up with any of these symptoms, it doesn't hurt and actually is very helpful to seek out a professional, because, we always kind of have a tendency to put our own needs last these days. And our eye health, it's so critical because we only have these two eyes, especially for vision. And fluctuating vision is actually one of the most common signs of having Demodex blepharitis issues. And so that, or itching, and it's such an easy solution to really keep it under control, to really help to maximize our eye health.
Great. Well, thank you so much for your time. This has